Welcome to my YouTube channel Bhutta Vlogs 14. So in this video we will see how to use a mental health care plan with Medicare. So we should start a video of today, and we will see that. So accessing your Medicare rebate is simple with mental health care plan. Things that we should to keep in the mind. You can choose the professional that you see. Next one is your doctor can help you find right specialist. And next we see that you will not get access to all sessions and at once. At first you will have 6 sessions. You will need to make another session with your doctor to review your plan and access more sessions. The Medicare rebate covers either all or part of the cost of sessions you are entitled to. The session might be bulk billed, meaning the entire cost is covered. The MSCP might cover the entire cost of session. There might be a gap, meaning you will pay an amount for session. If you have extras cover on your private health insurance, you may be able to claim benefits for consultations with a psychologist or clinical psychologist. Specialists might charge a lower rate if you have student card, have health card, have a pension card. How to claim rebate with Medicare? The simplest way to claim is at specialist on the day of your appointment. To do this, you must. In the appointment, you might also be asked to be in Medicare and show your Medicare card. Next, have given your specialist a copy of your MHCP. If it is not possible to claim on the day, you can make your claim with Medicare online. To do this, make sure you get a tax invoice from specialist for your appointment. Create a MyGovernment account online here. Link your Medicare account to MyGovernment online. Next, how long does a health care plan last? Mental health care treatment plans do not expire. Referrals to specialists do not expire at end of the year. If you don't use all your business during the calendar year, you can use them the next year. What will you be able to see psychologist? You might not be able to see specialists straight away. Psychologists are in demand and wait the time can vary. More Ashis are using public mental health care 110 last year up to 7%. Since the pandemic, 90% of psychologists in APs reported an increase in wait times. Half reported wait time of longer than 3 months. Every emergency departments are struggling. Only 63% of mental health related emergency department admissions were seen on time last year. So for this type of video, please subscribe my YouTube channel, click the bell icon.